Medicare can be confusing for many people. That is why when we work with our clients, in order to keep our thoughts organized and keep the clients on track, we do use a 6-step process. We already have the video out on step 1. Do I even need Medicare? Step 2, once you've realized if you need it, how do I get my Medicare? Then we also have step 3, once you have your Medicare, are you a Medicare Advantage or are you a Medicare Supplement person? And then we get to step 4, and that's filling in the gaps, right? When we do this business, we hold ourselves in very high standards. We do more than just the medical portion of Medicare. We help our clients understand what their risks are against unforeseen costs that come up from medical stuff, right? So the first step is when you have a supplement plan, you need dental insurance. So that's one of the biggest holes in a supplement plan is the dental. So you want to make sure that whoever you're working with goes over dental programs so you feel confident and secure that you have the coverage you need. The other big gaps would be in an Advantage plan, right? We know that Advantage plans, you have networks and co-payments, and most of the co-payments are manageable. However, there are a couple co-payments that are high, that cause a lot of stress, and we always want to make sure that we fill in those gaps. And that would be for the hospitalization and for cancer. On many Advantage plans, if you are hospitalized for a week, you'll pay upwards of $1,800 to $2,400, depending on the specific benefits of the plan. And with cancer, you will pay 20% of the cost up to the max limit. So we always like to introduce and show our clients that they can offset those costs by having a little ancillary product, similar to Aflac. It's not Aflac, but many people are familiar with that concept. So anyone that has an Advantage plan, we always recommend you get what's called a hospital cash plan. That pays you a daily amount to help offset the cost that you have on your Advantage plan. And you can get one of these between $18 and $30, let's say, depending on your age and health. And then we always recommend a cash cancer plan as well. Cash cancer plan is you get cancer, it pays you a flat rate of $5,000 or $10,000. That way you could use that towards your bills to help offset your costs. Some of the other things that we look at when we work with seniors is short-term and long-term care, right? That's in a whole video in itself, but please, we always want you to be aware of what are you going to do in the event that you can no longer stay in a skilled nursing facility on Medicare's dime, right? What happens is when you're in a skilled nursing facility, Medicare or your Advantage plan will cover you for so many days, but then they call and either you have to pay for it or someone else has to pay for it, and you can protect those costs with a long-term or a short-term care plan. Thank you. The next video, we're going to show you the difference between a Medicare Advantage and a Medicare supplement.